Hi all, my name is Dr. Rajesh Pathi. I'm a consultant neurosurgeon at OMNI Hospital, Kuvatpalli. Today we will discuss about headache and its various causes. I think most of you might have headache at some point of time in your life. So headache is a very common problem which has been seen in OPD basis. Even I have headache few times. Okay? So there are various causes of headache. Don't Google it and you come to a diagnosis that it is because of brain tumor or some other causes. There are various other common conditions of headache other than brain tumors or any other issues. So first we have to see those common causes because those are much more common and those are much more important when compared to headaches because of brain issues. So first and foremost, type of headache is tension type of headache or stress type of headache. So this is very common in our practice. What the patient will have is 30 or 40-year-old male or female who is working with family tensions, personal issues, professional issues. They'll be coming with bilateral headache, neck pain, lack of sleep. These will be the complaints. So what do we do with adequate rest and stress-free life? This type of headaches, 99.9% of this type of headaches will decrease. There is nothing much to worry about this type of headache. What you should follow is basically a stress-free life, adequate professional and adequate personal time as well as adequate family time and adequate sleep. These things will decrease this type of headache. The first is tension type of headache. What happens in this migraine type of headache is occurs mostly in young populations. So what happens is sudden exposure to bright light, sudden exposure to loud sounds, suddenly when the child cries, or suddenly when he's going to any functions where there are bright lights and where there is loud sound, suddenly they will have headache, severe type of headache, one-sided headache, especially in the periorbital regions, one-sided headache, unbearable type of headache. They just want to leave that situation and they just want to go and sleep, or just they want to go and be in a silent environment. So this migraine type of headache, when it occurs more, when you don't eat on time, when you are exposed to loud sounds, when you are exposed to bright light, when you don't have proper sleep, when there is lot of stress, and when there is a lack of adequate food in time. These are the triggering factors of migraine type of headache. So migraine type of headache is also treatable and it is very common condition. How do you treat it? 99.9% there will be medicines to cure it. Sometimes coffee will benefit this type of migraine type of headache. Second comes to headache which is related to neurological issues, that is related to brain issues, when there is some issue in the brain. So this type of headaches are serious type of headaches which needs frequent follow-ups, frequent monitorings and frequent checkups to the doctor. So there are various causes of brain-related issues of headache like brain tumors, brain injuries, seizures, fits or seizures. So what happens is you have to consult your doctor. He will see what is the condition, how it has to be treated, whether it can be treated with medicines or whether it needs surgery. So my final conclusion on this topic or this today's discussion is, don't jump to a conclusions. If somebody is having a headache, it is related to brain tumor or it is something emergency. First, change your habits of your life, like how you sleep, how is your work pressure, how is your profession, how is your family time. With these slight modifications, if it is treatable, then there is nothing to worry. If it is not treating even with these sort of conditions, then it is better you consult your doctor. Thank you one and all.